So the right to health is enshrined in numerous human rights treaties and international bodies. And obviously when we address the right to health for women and girls, sexual and reproductive rights are a key concern. However, in this case, in this situation now, I'm just going to mostly focus on non-communicable diseases, NCDs, which include cancer, cardiovascular diseases, chronic respiratory diseases, and diabetes. And those are largely driven by modifiable risk factors, which include tobacco use, unhealthy diets, harmful use of alcohol, physical inactivity, and outdoor and indoor pollution. And women and girls are at particularly high risk, given that 3 out of 4 women die because of an NCDs. They're really the leading cause of death in women, killing about 73% of women every year, and amounting to almost 17 million deaths per year. And while NCDs kill 3 out of 4 women, NCDs are often misconstrued as being of greater importance for men than women. And this leads to critical delays in diagnostics as well as treatment for women. And also we have to take into consideration that low-income and middle-income countries bear a disproportionate share of the burden when we talk about NCDs, with 80% of those preventable deaths taking place in low-income countries. Just as an example, deaths from cardiovascular disease in women is 1.7 times higher in low-income countries versus high-income countries. And if we look at breast cancers, for example, the survival rate for women in the United States is over 5 years is 90%, but it's below 60% in low-income countries. So NCDs not only kill a lot of people, but they're also a major cause of poverty and a barrier to economic and social development. And it's estimated to cause a cumulative global economic loss of about $47 trillion by 2030, which is about 75% of the 2010 global GDP. So it's quite a lot of money. And women are highly impacted by the risk-leading factors of NCDs. For example, a UNDP report noted that just 2 countries in the world have more women smokers than men smokers, but 24 countries now have more girls who smoke compared to boys. So we really see a feminization of smoking. And indoor air pollution, for example, due to cooking with inefficient stoves, is particularly high among women, who spend most of the time near the domestic earth. Gender influences also have a big impact on physical inactivity, obesity, and chronic stress, which are all risk factors for NCDs. So when we talk about physical inactivity, for example, there's a lot of factors that hinder the participation of women in physical activity. And those include lower income, workload, caregiving roles, limited mobility, cultural expectations, and fear of violence and crime in outdoor areas. And as a result, 84% of adolescent girls and 30% of adult women do not meet WHO recommended levels of physical activity. And this is all of those reasons. This is why there is an NCD target in the Sustainable Development Goals. And this target calls for target 3.4, and calls for 1/3 reduction of NCD deaths relative to 2015. But of the 194 UN member states, for women, only 35 countries will achieve target 3.4 of the SDGs. And there are many reasons for that, but one of them is also that most countries do not, health data is still not collected and analyzed separately for women and men, making it impossible to take a gender approach. As a result, the global burden of NCDs is expected to increase by 17% by 2025, and many women will die prematurely between the ages of 30 and 70 because of NCDs. So addressing NCDs will really help advance globally agreed UN governance processes such as human rights treaties, the Beijing Platform for Action, and the Sustainable Development Goals. Governments should take actions to address health inequities that are backed by a broader agenda of social support, education, and empowerment for women and girls, an agenda that requires a whole-of-government approach, concerted investment in social programs, and strong legislative action. Countries should provide universal health coverage, focusing on prevention and early detection, full implementation of global health norms, such as the WHO Framework Convention on Tobacco Control, the Global Action Plan on NCDs, and the Global Action Plan on Physical Activity. Countries should also adopt gender-specific targets and disaggregate data on NCDs and risk factors such as smoking prevalence, physical inactivity, and others among women and girls. Governments should recognize and professionalize women's role in delivering healthcare. They should adopt innovative screening methods for NCDs in low-income resource contexts, identify and address the barriers women face to addressing and accessing healthcare, including financial barriers, And civil society should fully engage in all reporting processes associated with human rights treaties to highlight successes and also challenges in protecting the right to health of women and girls. Thank you.